My legs started aching.
I'd have a fever and I could hardly breathe.
Swelling in my leg.
I would get so sick. I would let myself
had blood clots.
so sick to where
I go to Wake Med.
I had to go to the emergency room because of the cost.
I didn't have insurance.
I didn't have anywhere to go.
There's 45 million people in the United States that are uninsured, and 80% of that is working uninsured.
They're working hard every day. They're doing their best to support their families and to be productive members of the community, but they don't have health insurance.
And the numbers keep getting bigger and bigger and bigger.
Care is so episodic for people who don't have insurance because they wait until the last minute, literally.
Before, I was neglecting health, my own health. But now, I got a place to go when I can feel at home, when I feel comfortable.
There are people that are falling through the cracks in our society.
Can't even afford sometimes a $4 medication. And when you can come here and get that and I don't have to worry, that's wonderful.
People go to the emergency room, they kind of put a patch on the symptoms, they find out what is going on, maybe get some answers. Invariably, they're told you need to follow up with a doctor so that you can get this under better control. And then that's where the cycle just kind of breaks down.
The doctors referred me to this place called Alliance and told me to come here and talk to them due to the fact that I didn't have insurance.
People without insurance often put off taking care of themselves, either preventative health care or taking care of chronic disease issues.
We have shown that you can reduce the cost of care and improve the quality of life by delivering the primary care, the preventative care up front at Alliance.
Insurance is just one thing. Not having the money to see a doctor is one thing. But if you don't have the money to buy your medications, if you don't live in a neighborhood that's conducive to exercising, walking, purchasing healthy food.
The physicians will say, you know, I can treat and diagnose them all day long, but if they can't afford their medications, then we're not really making any headway. Last year, we actually dispensed $1.5 million worth of free medication to patients. We're really providing a huge service to those individuals.
One of the things that I think we do well here is trying to address the barriers to care.
They have their primary doctor. They're able to get their meds filled here. They're able to get their lab work done. And then to sit down beside someone and share their story of what's going on in their home, to share sacred stories that they're not able to share with anyone else, takes the heaviness off.
It helps having someone else in your corner, you know, cheering you on, wanting to see you do better.
We're really working hard to make a medical home that addresses all of the issues that they deal with, not just their health care.
We do look at their mind, their body, and their spirit. And we believe that happy people are healthier people.
Bottom line is they really care about what they're doing.
You know, they care at Alliance, they care.
Each of us is duty bound to care.